Nanoparticles are a diverse class of materials that include particulate substances which have one dimension that is less than 100 nanometers. Nanoparticles can be classified into four categories: 0-dimensional, 1-dimensional, 2-dimensional, and 3-dimensional. These dimensional categories relate to the number of dimensions of a material which are outside the nanoscale range of less than 100 nanometers. So a particle with a width and height of more than 100 nanometers but a length of less than 100 nanometers will be classed as a 2-dimensional nanoparticle, as 2 dimensions are outside the nanoscale range. So now you may be thinking, what is a 3-dimensional nanoparticle if all 3 dimensions are outside the nanoscale range? Well, these are materials which are not confined to the nanoscale in any dimension, such as a bundle of 1-dimensional nanowires.
In order to understand nanoparticles, we must delve deeply into the nanoscale. Nanoparticles can differ in terms of their chemical composition. So now we are left with the question, how does a nanoparticle's chemical structure interact with its surrounding environment? There are hundreds or even thousands of ways to explain how certain nanoparticles interact with their surrounding environment. Nanoparticles are exploited for their ability to deliver drugs to a designated area of the human body. In the context of medical imaging, nanoparticles can behave as either an active or passive imaging agent. Active agents mean the agent is the source of the signal, such as radioisotope, and passive imaging agents mean the incident imaging signals can be changed in a specific, reproducible, and predictable fashion. These are known as contrast agents. An example of a MRI contrast agent is gadolinium, which can enhance the relaxivity of surrounding water protons. In terms of computed tomography, or CT, nanoparticles that are made of a high atomic number element and are electron dense are effective contrast agents. Getting back to the topic, factors that characterize a nanoparticle's interaction with its surrounding environment include its hydrophilicity, shape, size, and particle charge. Nanoparticles contain ligands that surround the structure, as well as a substance that is relative to the use. An example can be seen here. These nanoparticles have polyethylene glycol, or PEG, chains, which is a common coating agent, with also a drug substance also attached to them, and typically have high affinity towards the surface of cancer cells.
So why are nanoparticles of any significance? Nanoparticles have unique physical, chemical, and optical properties. These unique properties can be manipulated to either enhance the capabilities of an existing modularity or to create a new diagnostic modularity. Most importantly, nanoparticles allow the components of a molecular imaging contrast agent to be easily assembled. As a result, such agents can, but are not limited to, be detected by multiple imaging modularities, deliver therapeutics, target specific cells, be designed to size, generate desired level of contrast, and be designed to a certain degree of biocompatibility. For example, a nanoparticle called superparamagnetic iron oxide has been widely used to induce contrast for T2 weighted MRI. While iron oxides induce negative contrast, which is signal loss, they are highly sensitive, making them very useful if the target to be imaged is expressed in a very low concentration. However, due to negative contrast, they are best used when the anatomy has a predictable structure, such as the human brain. On the other hand, gadolinium-labeled nanoparticles, such as liposomes, can be used to provide contrast for T1-weighted MRI through paramagnetism. These nanoparticles produce positive contrast that is easy to assign to agent accumulation in that tissue. The main concerns around nanoparticles arise from their toxicity. Nanoparticles may accumulate in vitro or in vivo, and over time they may chemically degrade. Detailed evaluations of specific nanoparticles is something that has not been thoroughly researched, and as such there is significant need for the development of efficient methods to identify the toxicity of nanoparticles.
In MRI, common contrast agents found today are paramagnetic and also have low molecular weight. A notable example include diagnostic agents of gadolinium nanoparticles, which are given to a patient by intravenous injection. This contrast medium significantly improves the visibility of inflammation, tumors, blood vessels, and for some organs, blood supply. It is very safe despite side effects being uncommon. Over 90% of the injected contrast medium is passed out in the urine within 24 hours, assuming normal kidney function. This particular study noted the use of a nanoparticle for multiple purposes in imaging macrophages in atherosclerosis. This image is a schematic of a quantum dot-based paramagnetic contrast agent. Quantum dots are considered the future for medical imaging due to the wide excitation windows and ability to fluoresce with high efficiency. The function of this nanoparticle relies on polyethylene glycol, or PEG, phospholipids for drug delivery. Advancements in nanotechnology can increase sensitivity and specificity in medical imaging.